So today we're going to cover the many different diagnoses that you guys hear about, that your doctors give you when you go visit your GP or your gastro. I'm just saying people have different symptoms with these digestive disorders. It doesn't mean the cure isn't the same, the treatment isn't the same, the diet isn't the same. It is the same with few exceptions. So I want that in your head. Our success rate for people who listen, take the supplements we suggest, and follow the diet 70 or 80, 90 or 100% is virtually 100% success. One of the ways that we know how well this works is that we have had many handfuls of patients, maybe many dozens of patients who were a month or a week or 3 days or whatever away from a scheduled surgery for a resection or removing of an organ and that kind of thing. And we treat them like we're in a panic, and we make sure they get on the 48-hour protocol and start right in and stick 100% to exactly what we tell them to do. H. pylori. So many of you have an H. pylori overrun, but once it overruns the stomach, the reason it overruns the stomach is it's the only bacteria that I know of that's not, there are a couple others, but in humans, the only bacteria that I know of that is acid resistant, and so it's not killed in the stomach. So if you know that you have an H. pylori overrun, that can mean that you're on your way to an ulcer, because once there's a section of damaged or missing mucosal lining in the stomach, H. pylori becomes almost like a flesh-eating bacteria. It is very corrosive, or however you want to look at it, to the stomach. It goes through the stomach lining. Once it accomplishes that, you have an ulcer. If you have H. pylori, one of the best things you can do is, and it doesn't matter, you could do it 10 times a day. You take 1 to 3 slippery elm. Slippery elm artificially, with a natural product, but artificially coats your stomach, your food, and your food takes it down and paints your small and large intestine with this mucosal lining from the slippery elm supplement. And for H. pylori infections, it's the key. So if you have H. pylori overrun, if your doctor has mentioned that, or if you have an ulcer, you should be taking slippery elm just real frequently throughout the day. And by doing that, you'll coat that ulcerated area. You bury and encapsulate a lot of the H. pylori bacteria. And instead of your stomach lining being exposed to that acid 3 or 4 or 5 or 6 times a day, you'll never get better like that. Even with antibiotics killing the H. pylori, the problem at that point, once you are ulcerated, is not the bacteria, it's the ulcer. And then people who have an immune dysfunction, like some people with Crohn's or celiac, the main thing that happens that's devastating when you have an immune dysfunction is your body can actually start attacking itself. Your white corpuscles can start recognizing things that are normally benign and friendly and part of a normal body function, start seeing them as an enemy and start an attack. And this is why some people get leaking gut and different things in the intestine. So I would say the solution to that, once again, you always have to avoid anything that causes you trouble. We've pounded away at that enough. But if you're sensitive to gluten, as most celiacs are, or if you are sensitive to peanuts, lettuce, seeds, if you're mildly allergic, if you get any kind of a negative reaction or symptom when you eat something, some people are very sensitive to dairy products. If you have those sensitivities, stop eating those things altogether.